The closure of the AV valves, that is atrioventricular valves, which is the tricuspid valve between the right atrium and right ventricle, the bicuspid valve between the left atrium and left ventricle, produces the first heart sound, which is called lub or S1. Whereas the closure of the semilunar valves, which are the pulmonary valves within the pulmonary trunk, the aortic valve within the aorta, causes the second heart sound, which is called the dub or the S2. So the heart sounds are basically S1, which is lub, and S2, which is dub. S1 is due to closure of AV valves, atrioventricular valve, whereas S2 is due to closure of semilunar valves, and it's called as dub. Thank you for watching and learning from Logic Medico.